topic of today's presentation is called Warming the Climate for Men in Nursing Education. Have you ever wondered why is there so few men who participate in the nursing profession today? In fact, currently men make up only 10% of the RN workforce. And just a generation ago, in the 1960s, only 1% of men were participating in the profession. Today's presentation will look at how the past history of nursing has influenced the present reality and ongoing barriers in the culture as well as even within nursing education that impact and influence the success of men as students within academia. But more importantly, we'll address how we can break down those barriers and truly celebrate and encourage the diversity that is required in nursing and nursing education today. How many of you saw this movie, Meet the Parents? It was very funny, at least the first one. But did it do anything to encourage and influence the dynamics of men who are nursing? Did it really give them a positive or a negative image? Because what was the name of the key character? It was Gaylord Fokker. And it was no coincidence that his first name was Gay Lord. That was intentional and reinforced the common stereotypes that men who go into nursing are either effeminate, homosexual, or not smart enough to make it to med school. So though this movie was funny, it did nothing to encourage men to go into the nursing profession, and in fact reinforced the ongoing cultural stereotypes that continue to linger for men in the nursing profession. But as we look back at nursing, has nursing always been predominantly female as we know it today? In fact, if you look at the historical legacy of men and nursing and looking at the aspect of caring for the sick, actually, when you go back to men have been at the table for over 2,500 years who were predominantly the caregivers, going back to ancient Greece in the era of Hippocrates and the infancy of medicine. Men were the caregivers in that context in the public institutions in ancient Greece. In ancient Rome, in 400 BC, all the way into the modern AD era, men were caregivers for the wounded soldiers in ancient Rome as they came back from battle. Men who were caregivers were called nosocomi, but they did not do their job well because we have something titled after them called nosocomial infections. And nosocomial infections, as you know, are hospital-acquired infections. Also in the BC era, men in India were the predominant caregivers in that context. The very first nursing schools in India in 250 BC, basically men were the only gender allowed to care for the sick. Now as we go into the AD era in the early Christian church, men as well will continue to be the predominant caregivers, as well as women in the monastery orders of the early Catholic Church that was present throughout all of the AD era and the Middle Ages. You had the monastery orders of the 300 AD, the Parabolani. Those were men who sacrificially served and cared for the sick of the bubonic plague in that context, caring for those that ultimately died, and many of the Parabolani actually died as well in that context. You have the brothers of St. Anthony and St. Benedict as well in the early Middle Ages. You had the military knight orders as well in that context. And so recognizing that men have been at the plate historically all the way until the 1600s. But then something happened in the 1800s. There was a woman who had this, who was predominant and who was very influential in the modern era, who had this mindset and said, quote, "Every woman is now a nurse, and that men have no place in nursing except where their physical strength is required." She also said this, "Men's hard and horny hands were not fit to touch, bathe, and dress wounded limbs, however gentle their hearts may be." Now, of those quotes are attributed to Florence Nightingale. the founder of the modern era of nursing. And in the context of her lens of practice, men were not welcome, primarily because of her Victorian ethic that recognized that women who were caregivers in the home had no other way to demonstrate their giftings and abilities. And she saw nursing and caring for the sick as a way for women, as an empowerment for women. And men who had strength, where were they required? In the insane asylums. And so men in nursing were welcome, but were allowed to practice in Nightingale's era in the late 1800s in the context of psychiatric care only. And so the consequence of these dynamics to men in nursing is that men were not allowed admission to the Nightingale schools of nursing that were 3 years in length. They were excluded from general nursing practice and again relegated to the insane asylums. They received an inferior education of approximately half that of those who were generally trained by Nightingale. And then if you were a male nurse and wanted to expand your training to other areas, you were considered a pervert and threatened with expulsion. So men really had nowhere else to go except the psychiatric care in that context. And that bias continued to linger after Nightingale in England. In 1919, the General Nursing Council, which was in essence the State Board of Nursing, only if you were a woman were you granted full membership to the Nursing Council. And so you had, by the 1930s and 40s, literally men were extinct. There was only 0.004% of men were caregivers or nurses in that context in England. And that is one of the reasons why men continue to be at such historic lows in England as well as here in America. But as we look at institutionalized gender bias here in the United States, the American Nurses Association was formed in 1897, and men were not allowed to be members and participate in that organization from 1897 all the way until 1930. The ANA used their influence that men who were in the service were not allowed to care and be a nurse in the context of serving in the military all until after the Korean War. So from the 1900s to 1950s, men were not allowed, even in the military, to be caregivers. And so this lingering bias of men in nursing historically from the 1800s and the 1900s continues to linger in varying ways today. For example, in the 1960s, only 15% of all colleges and universities allowed men to even apply. 85% excluded men to even apply to their programs based only on their gender. And this continued all the way until one program in 1981, which was the same year that I graduated from high school, continued to have this policy of gender exclusion of men until 1981, where that was overturned by the Supreme Court. And as recently in the 2004, one of the greatest battles that we see with men in nursing is their ability to participate in the OB world. That there was a hospital in 2004 that did not allow men who were qualified and trained as OB nurses to work on an OB floor because of their gender alone. And so as we look at the influence of Nightingale's exclusionary policies towards men in nursing and the bias that men experience, look at the dynamic of men in nursing made up approximately 1% of the workforce of RNs in the 1940s, 50s, and 60s. And the reason for that goes back again to Nightingale. But look at the slow progression. Men have been averaging about 1 to 2% increase in male participation within the nursing profession in the 70s, 80s, 90s, 2000. The most recent statistic is 9.6% in 2011. But what's interesting is compare that to female residents, females who want to be physicians, and how women encountered similar barriers of participation in the 1950s, where only 5.7% of all residents were women. But now look at here in over the last 4 decades, women have now achieved gender parity within physician practice, but we have not even come close to that yet for men in nursing. As we also look at minority representation in nursing, one of the reasons that this is so important, why we need to encourage men as well as ethnic minorities in the profession, is that we have an incredible nursing shortage on our hands. We have the baby boomers retiring, and we now have a dynamic where we're forecasting almost 1 million positions will be short in the next 10 years by retirement and need. And where are we going to find additional nurses to be filling those spots? Well, men make up almost 50% of the profession, make up less than 10%. Men in nursing are the predominant answer to the nursing shortage, and is why nursing and nursing education must break down every barrier to make that possible. Look at ethnic minorities. African Americans make up 13%, only make up 5% of the nursing profession. So African Americans as well as Hispanic are the two ethnic minorities that we need in order to encourage and to answer the nursing shortage. But it's men in nursing by far that is the answer that is going to bridge that gap that we so desperately need. And it's important to recognize that men in nursing go into nursing for the same reason that women do. They're not in it for the buck, that many women and even faculty have those assumptions. They really do desire to care and to help for others. And they value the opportunities, that mobility. They can go into advanced practice. They can go into anesthesia, as well as the demand that and the security that nursing offers. But really the heart motivation for most men is that they really do care. So as you look at the barriers, the social and cultural barriers, what is it that really limits the participation of men in nursing? There's no doubt that the feminine image of nursing continues to linger, that nursing for most men is still considered to be a female profession. And the dynamic that also needs to be recognized too is that the name of the profession dovetails with this feminine image, that being called a nurse is a feminine construct, that to be called a male nurse seems almost hermaphroditic in the sense that it seems like it's male and female. What is that? Why are not women called female nurses? But it's exclusionary primarily to men. What's interesting is that in other professions that have had a dominance of men, and when women began to enter it, they changed the name of the profession. For example, fireman, firefighter. Policeman, police officer, gender neutral. Looking at the title stewardess, when men began to go into that female-dominated profession many years ago, they changed the name to flight attendant, gender neutral. My question that I would challenge the nursing profession to consider is that because the title of the word nurse is so femininely constructed, and when they did a study, when they did a survey of 100 adolescent male students who were seniors in high school, said, would you go into this profession if it was called nursing? A percentage of only 6% said they would. When they changed the name gender neutral, it went almost up 4-fold percent. They used the word registered clinician, and almost 4 times the amount of male students, high school students, would consider the profession if it was gender neutral. So just an interesting observation, but yet something I think the nursing profession needs to consider. And as we look at stereotypes, Meet the Parents reinforced almost every male stereotype that still lingers today, that if you're a male nurse, you're homosexual, effeminate, an underachiever, not smart enough for med school, or a sexual predator, or even not as caring and compassionate as women. But women also experience stereotypes. The most dominant one is the naughty nurse, and the sexual objectification of being a nurse in that context does nothing to elevate women in the profession. Recognize that the male stereotypes that men experience are just as destructive as the female naughty nurse. As we look at the barriers in education, I'm going to highlight 8 specific barriers that are present in a general way across most of the country. Number 1 barrier, I'm going to just list them in the concept, not necessarily in order of frequency, but just by their number. The first barrier, no history of men in nursing. 2, no guidance on masculine styles of caring. 3, no guidance on providing intimate touch. 4th, no guidance on differences between gender communication. 5, a chilly or not a very supportive classroom climate. 6, the exclusive use of lecture in classroom. 7, the feelings of isolation and loneliness that men experience. And then finally, the lack of male mentoring and role modeling and how that influences the success of men in nursing education. So let's look at these one at a time. I am grieved that most nursing textbooks do not adequately or completely eliminate the context of the historical legacy that men have had as caregivers going back to ancient Greece, ancient Rome. This history is revised, eliminated, or not even discussed in the majority of nursing textbooks today. And though you may not see it on this slide, this is a page from Potter and Perry 2 editions ago. It doesn't currently have this table, but the very first table of their History of Nursing page, the very first entry was this: 300 AD, entry of women into nursing. Now that is off by 1,000 years and the wrong gender. It was men who were the first caregivers in 400 BC. And again, it was men, not women, who were entries into nursing. And so this dynamic continues to prevail and persist within academia and within textbooks today. And I'd encourage you to look at your textbook that your program uses to see if that context is true for you as well. And it's important to know that men, if male students do not have any knowledge of the past, it gives them no ownership for the present. It gives them no context and doesn't allow them to recognize that they have a history, a legacy. And when that legacy is unknown, it continues to reinforce the assumption that nursing and caring for the sick has been dominated by women throughout time, when in fact that is not the case. Number 2 barrier, masculine styles of caring. What's important to recognize is that men and women are created very differently. And women traditionally use touch to demonstrate caring to their patient. But what most faculty don't recognize, as well as students around them, is that men do not use touch as their default mode of caring. Instead, they will use humor, and they will use that to establish rapport with their patient and develop that kind of friendship using humor. And so recognizing that men care, they just demonstrate it practically very differently. And that needs to be recognized as well as appreciated by student colleagues as well as by faculty. Number 3 barrier, no guidance on intimate touch. And what I mean by this is simply this, is that men who provide as nurses pericare or inserting Foley catheterizations feel very vulnerable, because in the context of that touch, even though it's appropriate, it could be construed or seen as something sexual. And the dynamic is that men in providing care recognize they are very vulnerable, because it is their word against the patient's, even if that patient is confused. And so it's important to recognize is the dynamic that men basically need some guidance to just acknowledge that vulnerability that most women do not experience because of their gender as it relates to nursing care. And so some practical ways, that some safety strategies you can use when using touch if you're a male nurse, is take time to develop trust with your patient. Maintain a professionalism and project professionalism as a nurse. Have a chaperone whenever there's a determination that it may be unsafe, like the patient is confused and it could be your word against theirs. You can also delegate intimate care to another female colleague. I always ask, regardless of the age of the patient, if I'm going to do Foley catheterization, for example, are you comfortable with me as a male doing this care or doing this procedure, or would you prefer a woman? And if they say they're fine with me as a male doing that care or that catheterization, I'll do it without any chaperone. But if they're very clear that they would prefer a woman, or their nonverbals clearly communicate that, then I will have one of my female colleagues do that, and I will then do a task for that person, the female nurse, to basically balance out that equation. It's also important to modify techniques to limit exposure. If you can limit any type of exposure of a woman during the provision of intimate care, that's going to be respectful, it will be appreciated, and it demonstrates, again, that professionalism. So these are just some simple strategies that, as a male caregiver, you can do to ensure that context of professionalism and safety as you provide intimate care. The fourth barrier to men in nursing education relates to gender communication. This is very interesting because men and women are created very differently. And therefore, when it comes to communication, women tend to use communication and rapport talk to connect with another person. And they liberally give praise and tend to be non-judgmental and do not rush to judgment. But men are not nearly as verbal. They want just the facts, and men typically give praise only if it was done well, whatever it was that is being offered praise, and men tend to rush to judgment. And why this is important is, especially when it relates to nursing educators, is that men had that preponderance to rush to a judgment. Therefore, it's important that we essentially allow ourselves that grace to not make that judgment too quickly. And as an educator, we need to be very careful that we encourage our men, have they considered all the options before coming to a conclusion as it relates in the context of care. The fifth barrier is a chilly classroom climate. And what I mean by this is that men do not typically feel as well supported in nursing education compared to women. And in the context of this, there was an example where they did a study where the researchers asked the question of both men and women students, describe an experience that was personally meaningful to you as a student. That every 75% of the female students used an example that was meaningful with nursing faculty, but the men in the program, every one of them chose an experience with a patient that was meaningful, did not have an experience that they felt warranted that was really that meaningful with faculty. And that men tend to feel at times a sense of being singled out, and assumptions about their motivation for going into nursing that are not well taken, such as they just are in it for the money or to be a nurse anesthetist and all that goes with that. Men traditionally in many programs in the literature have not felt that support from educators compared to women. The sixth barrier in education is a lecture classroom. What's interesting is that women tend to have an auditory learning style and prefer a formal classroom. Women tend to be relational learners, and men, in comparison, are much more kinesthetic and hands-on. They want an active classroom, an active and learning environment. And so therefore, men typically want more of a need to know, just the facts, and not a lot of background information. And so therefore, a lecture classroom that's predominantly present in many education programs across the country is a barrier to the way that most men naturally learn. So therefore, anything related to active learning, active engagement is going to promote the learning of male students. And finally, we'll put 7 and 8 together: the isolation, loneliness, and the lack of male role models. These two barriers really are significant for men, just as it would be for ethnic minorities. But when men do not feel this lack of support And they're already isolated because there's not as many in most programs. They're almost always the minority. They basically feel a sense of ambivalence about being a nurse and being in the nursing profession. And so therefore, they typically tend to be very ambivalent at the end of the day, that if they encounter some significant struggles within nursing education that inhibits their success, they're much more likely to walk away and to not continue and persevere in nursing education, and their failure to complete rates are extremely high. In fact, in one study in England, identified that men in nursing education had almost a threefold increase in failing to complete their program compared to women. And in fact, in many programs across the country, I have seen percentage statistics of 30 to 40% of all men who begin the program fail to complete it. And so therefore, men today continue to be very high risk and are not successful in completing their program. And that's one of the reasons why I'm doing this video for Belen, is to help kind of address those barriers, bring them out in the open, and hopefully you as students as well as colleagues can recognize their unique needs and support them in the context of their nursing education. And again, why are men such high-risk students? Again, it's about the role strain, that dynamic of just being a male in a female world. Over time, for many men, takes its toll. The stereotypes, the barriers, but more importantly, the lack of male role models and what that represents, that there's very few male faculty. And therefore, men who are already feeling that isolation, they don't have anyone they can really identify with in their program, as well as on the floor. There's very few male nurses they can identify with. And so therefore, they feel that burn. And it's very important that as educators, that you really put male students with male educators in the clinical setting as much as possible, as well as if there's male nurses on the floor of your institution that you're having clinical, those belong with your male nurses or your male students to get that sense of role modeling and to decrease the isolation that men in nursing experience. And so therefore, practical steps that we can do to retain male students is, again, beware of that tendency to isolate male students. If you have, like, for example, 2 male students, don't put them in separate clinical groups. Put them together in the same group. They need that support. As well as just looking at making your classrooms active learning and emphasizing active pedagogies and the ways to teach. Allow men to basically work with other men in the context of clinical instructors as well as with them in the practice arena. And as I look at just some things on the websites, just looking at some of the programs, some programs, they have all the ethnic minorities, but they're forgetting somebody, and that's, again, men. And that's not universal, but yet recognize that even at Belen, look at your promotional materials. Make sure that you're including not just women of varying ethnic minorities, but also men and what that represents. There's an organization called the American Assembly for Men in Nursing, AAMN.org, that is the professional body for men in nursing and nursing education, primarily within men in the nursing profession as well as students. Belen has a chapter of this national professional organization that is not just for men, but it's also for women who are sensitive and want to support students and men in the profession and advocate for them. They're an excellent advocacy organization that I would encourage you to consider participation in, and in that context. This is just a slide, Changing Culture. Are you man enough to be a nurse? With many examples of men who are karate experts, professional athletes that are basically have a history of also being male caregivers as well. And so, excellent poster. I had it in my office when I was a nursing educator and got a lot of comments from that. Johnson & Johnson also has a poster campaign on changing culture and being a nurse, featuring men as well as women who are representing the profession well. As I encourage you to go from here and look at next steps, there's a couple of books that I think, especially if you're a male student, I would encourage you to read A Man's Guide to a Nursing Career by Chad Olin. He incorporates the history of nursing as well as just practical steps that you can that will help guide you to be an effective and increase your proficiency as a student and just understanding your legacy and what that represents. Man Up is another book that I've also written that also kind of has those same themes. They're both on Amazon. They're both around $20. I would encourage you to receive those and to purchase those. In closing, I hope you've enjoyed this presentation. But what I want you to do is to reflect and to look at your own biases and assumptions that you may have as a woman as it relates to men in nursing and nursing education. Do you have any biases or assumptions about their place in the profession? Hopefully this presentation will help enlighten you to recognize that men are welcomed and should have a place within the profession. I also want you to look at what practical steps will you take to support men and ethnic minorities in your program. It's one thing to celebrate diversity, but what will you do practically to support this diversity? So I would encourage you to really go out of your way to support and to check in with your men and any minorities in your program to see how they're doing. I can tell you that they will welcome that and appreciate that and feel that needed support that will be something that they desperately need. So as you look at this, make it a priority to celebrate this diversity, and this will lay a foundation of respect that is so needed in the profession so that you will have what is required to be the needed change as you not only are a student at Bellin, but as you go forth and in practice, you will be a part of the needed change that is required to really celebrate the diversity that we so desperately need within our profession. Thank you for being a part of that needed change.